Hello, I'm Dr. Claudia Martinez. I'm currently a spinal cord injury fellow at UT Health in Houston.
Hi, my name is Joanna Rosales Chavez, and I'm a fourth-year Med-Peds resident at the University of Tennessee Health Science Center.
My name is Kalechi Wachukwu, and I'm an orthopedic surgery resident at the University of California, San Francisco.
Gano, Lindsay Nigyaso, Goyokono Niwakwenzote, Ganyate Niwakishore. Greetings, my name's Lindsay. I am from Upper Cayuga Nation, Turtle Clan. I'm a first-generation physician and second-year resident in integrated plastic and reconstructive surgery at University of Chicago Medical Center.
My name is Monique Johnson, and I'm a second-year resident at University Hospital's Cleveland Medical Center in anesthesia.
Hello, my name is Dr. Esteban Peralta with ophthalmology at Duke University.
My name is Luz Gassi, and I am a second-year reproductive endocrinology and infertility fellow at Brown University and Women and Infants Hospital.
My name is Ntamia Ching, and I'm a third-year obstetrics and gynecology resident at the Women and Infants Hospital in Brown University.
Hi, my name is Fong Tran, and I am currently a third-year pediatric resident at the Children's Hospital of Colorado.
I'm Dr. Therese Thomas, a pediatric pulmonary fellow at Nationwide Children's Hospital in Columbus, Ohio.
With this grant, I plan to start my own nonprofit that aims to help provide underrepresented minorities and underrepresented patients in Houston with durable medical equipment, caregiver services, and medications that they otherwise wouldn't be able to receive. As a patient myself, it's very important to me that my patients have these things. And as a doctor, I plan to help my patients in the hospital, but also beyond the doors of the hospital.
After graduation, I'll be working as a primary care physician at a federally qualified health center, and this grant will allow me to attend medical conferences and join professional medical associations who advocate for the underserved and uninsured communities, as well as promote health equity. As a first-generation Mexican-American and a woman in medicine, this grant also empowers me to continue to promote the medical profession among minority populations with the goal of increasing representation and ensuring that our healthcare system reflects the diverse communities that it serves.
This grant will help with my career development and will help fund independent initiatives that are geared towards inspiring minority youth to higher education.
This Panacea financial grant will directly support my efforts to increase in Native American representation within surgical fields, including resources to support hands-on workshops, mentorship avenues, and conference travel.
With this award, I'll be able to continue and further my research on the perioperative pain management experiences of underserved communities, looking for ways to improve that experience.
The grant will allow me to participate in a 2-week international outreach trip where I will learn a specialized surgical technique used in removing dense cataracts, which are common in low-resource settings. The grant will fund travel expenses as well as medical supplies and other essential equipment and enable me to really fully dedicate myself to serving this underserved population.
As someone who is deeply committed to expanding fertility care access, but also to improving surgical outcomes in patients, the scholarship will allow me to attend a surgical bootcamp hosted by the Society of Reproductive Surgeons. It would allow me to expand my knowledge on reproductive surgery, but also to connect with leaders in the field.
I plan on using this award to assess the experiences and challenges faced by underrepresented minority residents within OB/GYN residencies as it relates to diversity, equity, and inclusion. My hope is that through this focus group qualitative study, we're able to identify challenges, barriers, and also strategies to foster a more inclusive training environment.
This upcoming July, I will be pursuing a fellowship in pediatric cardiology, also at the Children's Hospital of Colorado.
I'm interested in advocacy and I'm very passionate about health equity research. It is something I would like to continue pursuing in my career. The current research project that I'm working on right now looks at the quality and effectiveness of inpatient communication in a pediatric hospital by providers to families, caregivers, and patients who speak English compared to Spanish, compared to non-English and non-Spanish speaking families. This grant provided the financial support for me to attend the pediatric academic societies, where I was able to present a poster of my findings so far. I was able to also talk with other providers who are also very passionate about health equity research, and we were able to bounce off of ideas on ways to make changes and implement changes in the hospital to improve care. Furthermore, this grant will allow us to continue research
by providing the funds to support patient participation recruitment.
This award will help my work in health equity, particularly for children living with chronic lung conditions who face additional challenges due to social and structural barriers. I'm appreciative to the Panacea Financial Foundation for investing in trainees like me who are dedicated in building a better future in medicine that's inclusive and equitable for all.
Thank you again, Panacea Financial Foundation, for providing me with this ability to help my patients.
Thank you, Panacea Financial, for supporting my mission and for investing in the future of healthcare.
So thank you again from the bottom of my heart.
And Yahweh, thank you, Panacea, for supporting my mission to uplift future Indigenous surgeons and in turn, strengthen our communities.
Thank you so much, Panacea Financial, for this awesome grant award and the recognition that it bestows.
I would like to thank you so much again for investing in my medical journey, and I look forward to continuing to serve my community and to advocate for my patients. Thank you so much.
Thank you once again, Panacea, for this continued support of residents and fellows through our work.
Thank you so much to the Panacea Foundation for choosing me as a recipient.
I'm incredibly grateful to be selected as one of the recipients for the Panacea Financial Foundation Resident and Fellow Grant.